Washington. But, you know, there was this wonderful comment that the lady made that this system is not government run. That's one of the myths we have to take out right away. Because
so socialized.
The doctors, the doctors do not work for the government. The doctors are still independently employed and are selected by the patient, not the government.
But what happens to the insurance companies? Where do they belong now?
Well, the insurance companies fold under one. This is where the single payer term comes in. We have one single payer that is the insurance company. And so we relieve you of the incredible choice that has to be made about which insurance company to go to. You know how much money they spend in advertising? The hospitals are advertising. The doctors are advertising.
Well, don't you see that there's got to be a lot of resistance then from the insurance companies because, to face it, they're making a lot of money off of this. I mean, I used to be a litigation specialist for insurance. And,
is that right?
Yeah, actually, one of my many titles.
In a previous life.
Yes, and in this, I mean, it was always, what is the bottom line? You know, always do fair by the insured, because you don't want a lawsuit about bad faith, but always make sure that you're looking at the bottom line, and that's you approach everything on that point from an insurance company. So this has got to have them panicked.
Well, in Sicko, they had this one lady was a moving part of the documentary, who was an insurance claims adjuster, and she was rated on the number of people they had turned away and had not provided medical care for. And they compared her rate of turnback on other people that were adjusting claims. And she got called in and said, you know, what's with you? And the pressure got so hard on her that she couldn't, in good faith, stay with the company because she was being paid and rewarded on the basis of how many people they did not provide health care for. And so you're right. We haven't had one insurance company come out supporting H.R. 676 yet. And that's because to them this is a business. They have to provide a profit and a return for their stockholders. The business is a corporation. It's there to make money. And what we do is say, wait a minute, hold it. Let's have...
Actually, we're going to hold it right there.
Now that I said that.
We're going to go ahead and take a short news break, and we will be right back to continue this discussion. Welcome back to American Dream. Tonight we are talking about health care in America, and we have Congressman Conyers, House Judiciary Chairman. And we also have Radia Daoussi, with the president of the Vinetta Foundation. And I wanted to go ahead and actually get to some of the questions that we haven't gone to yet. Is we keep saying that when people come in, they don't have to pay. So the question is, well, then who's going to pay? Because obviously somebody's going to pay for it. And where is this money going to come from? And if the insurance companies aren't there to make their profit off of it, where's the money going to come from?
Well, that's the key question here is, will this cost more or less? And we've had GAO studies and independent examinations of this by medical economists, and now the medical community itself is coming into this, because the way that we will save money is that the money that we save, as opposed to all of these dozens and dozens of insurance companies, HMOs, and other providers that are making huge profits, that money will now be used for not the 45 million, but is now up to 47 million people who have no insurance, and incidentally other millions of people who are insured, but they're not insured for the right thing. If you read into their insurance
fine print
policy,
of the contracts on the insurance policy.
yes, as a former insurance person, you know that.
Yeah, you get trained for months actually on how to read a 3-page policy.
Right. And a lot of people are shocked to find out that they've been paying insurance every month on their policy, but it doesn't cover what they really need it for, because nobody knows when you're going to get sick or what you're going to need. So the ability to cover everybody, even though they can't pay, comes from the huge amount of money that will not be going into profits, overhead, administrative costs, advertising, and all of these things. And what we've figured out is that we will spend less money because you yourself mentioned the idea of prevention. If you create a healthy country of citizens that are being checked annually, then you don't get into the huge complications and enormous costs that will attend if you're not being treated.
When it first implemented, who is actually going to bear the brunt of the cost? If it's not obviously going to be the poor. Who is it? Is the workers going to pay for it? Is the rich going to pay for it? Who's going to pay for this?
Well, we set up a trust fund. It's like Social Security. Everybody will be paying into it. Now, we say we break the employer insurance connection, a health insurance connection. Our insurance will nobody will care about where you work, or as a matter of fact, if you're working. But everybody, including employers, will pay a small percentage of their income toward the plan. So the plan isn't free in the sense that a person working doesn't have to pay anymore. The person working now will pay less than they are paying now in an employer-based system, but it will...
There's a percentage that the top 1% pay 10% of the...
Yes, they pay more, slightly more, but anybody working pays about 3.3% of their income.
What pretty much when you're working, you're already paying that as part of your share anyway, as a worker. I mean,
frequently more, and if you get sick, where the co-payments come in, or it's something not covered, or long-term illness, or psychological treatments, or long-term diseases, cancer, or anything like that, your insurance isn't going to cover you anyway. So what our economists have calculated is that by taking out the profit